And good morning. Welcome to both of you. I have Tina Campbell right here, and I have Utunda Bondelli.
Yes.
Did I say that correctly?
Close enough.
Okay. Thank you for being here this morning. You are from Nash UNC, and we're here to talk about Parkinson's disease, which I think is so important. You know, we're seeing more of that all the time, and I don't know if it just wasn't diagnosed in the past, but all of a sudden we're seeing a lot of that. And, you know, it's such a debilitating disease.
It is.
It really is. It's sad. It can be a very sad disease. What is, Tina, what is Parkinson's disease?
Okay, Parkinson's disease occurs when a chemical in the brain stops being created by the brain's tissues, and that particular chemical is important for movement, for people to be able to move well, to get out of bed well, to be able to swallow, to be able to speak well. And when that happens, they have more difficulty doing those tasks.
Wow. So it just stops.
It slows down tremendously, but their perception of their movement is what's the key to our treatment interventions, because they feel like they're moving pretty well, but they're really not. And with our treatment interventions, it helps us to get them to move a little bit better with a little more effort.
How prevalent is it in the United States?
They expect in the year 2020 there'll be 1 million people living with Parkinson's disease.
Really?
Mm-hmm. And North Carolina has about 24,000.
Wow.
Mm-hmm. Someone had once told me that North Carolina is the third state that's the highest in retirees wanting to move here. And of course, Parkinson's affects people above the age of 50. About 96% are above the age of 50, which means about 4% are below the age of 50.
I wonder if is there a certain area that's worse for Parkinson's disease than others in the U.S.?
You know, they haven't quite figured that out. I think a lot of it has to do with the population density in terms of the prevalence.
It makes you wonder if it's what we eat, if it's what we lack of activity. You know, what is it? So
they haven't quite figured out the reason for it. They might have some genetic component, but it's not really found to be a strong genetic component.
Oh,
they
wow.
have some thoughts about it maybe having to do with chemicals, people in the Army or the services, people who've been farming a lot, but they don't have a strong connection with that either. They're not real sure. That's why they're doing a lot of research.
wow, that's very interesting. Well, what are some of the early warning signs?
Well, of course, you see a lot of people with Parkinson's having a shaking in their hand. Sometimes it can be in their
Yes.
jaw, sometimes it can be in their leg. A lot of times it happens just on one side and then it gets a little bit worse. So that's one of the early warning signs. Another one is small handwriting. You know, as we age a little bit, we start writing a little bit smaller, but they think it's even smaller than that. It's real small and hard to read.
Oh, really?
Mm-hmm.
So the handwriting gets smaller?
Mm-hmm. And think about that. Writing is a motor type activity.
Yeah.
And so if you're not using your hand as well and moving as large as you think you are, your handwriting is smaller. One of the other ones I think is kind of fascinating is loss of smell. As we age, we do tend to lose our sense of smell a little bit.
Right.
But smelling things like pickles and licorice and bananas, those things that have a distinct smell,
Right.
a lot of times people lose that smell.
Wow.
Trouble sleeping. People with early signs of Parkinson's have a lot of restlessness with their sleep. And again, a lot of these early warning signs, just because you have them doesn't necessarily mean you have Parkinson's, because there's
Right.
a lot of normal explanations for many of these. Trouble moving or walking. You notice people with Parkinson's with that shuffling gait,
Right.
or that festination where they kind of stop a little bit, or the freezing of their
Right.
gait. Constipation. Again, that's your gut. It's motility, the movement of things in your body, and sometimes
Right.
that happens. What Bridget will speak a little bit more to is a soft or a low voice.
Right.
Most people with Parkinson's feel like you have trouble hearing. It's not me with my voice. And you notice a lot of people with Parkinson's with the masked face, that flat, we call it an affect, but that flat looking face, expressionless.
Right. Is it easy, Tina, let me interject.
No problem.
Is it easy to confuse this with a stroke?
Potentially. The stroke has certain warning signs with the facial droop, the arm or hand not moving, and on one
Yeah.
side. That usually comes on suddenly. Parkinson's tends to be a gradual kind of, you notice some of these things, or
Okay.
you may not notice them. It might be a family member that notices it. But yeah, strokes are usually more sudden.
Okay. We'll let you continue. with
That's
the
fine.
signs.
It's just a couple more, just dizziness or fainting, and trouble with your balance, and then that stooped over, hunched over posture sometimes people with Parkinson's has.
Wow.
But what I would say is, if you're noticing these, or if you notice a loved one with these, check it out with the doctor, because like I said, a lot of these have normal explanations, can be normal parts of aging or normal or other issues, but there's not a real good test for Parkinson's, so it's kind of hard. So sometimes the doctors, if you go to see a doctor, the neurologist is usually the one that helps you with the diagnosis. They'll check you over, check out your symptoms, maybe put you on a medicine to see if it makes a difference or not, and if it does, they might say you have Parkinson-like traits.
Wow. What kind of doctor treats or diagnosis?
The neurologist is the one who's an expert in the field, because this is a brain-related disease. So the neurologist, and we have some good local neurologists here.
Right, we do, absolutely. So both of you are physical therapists.
Yes, ma'am.
Okay. Well, tell me, we'll go over to you now, Yatunde. What does physical therapy do for a Parkinson's patient?
So physical therapy, we try and let the patient move better, because we find that people who have Parkinson's move slower.
Okay.
And so in physical therapy, we'll show them exercises, and we try and encourage them to take bigger steps. If they're moving their arms, move their arms bigger. We try and challenge their balance, because a lot of patients who have Parkinson's tend to fall. Now, we have the traditional therapy that we perform, but thanks to a grant from the Parkinson's Foundation, through Elaine Wiesner, who was our clinical coordinator at the time, we were able to get some therapists certified in specialized programs that are geared towards patients with Parkinson's disease.
Right.
We were also able to get some high-level equipment for our aquatic pool, and this really challenges patients in the water, but it's also safer because they don't fear falling as much, and it's also helpful for patients who have orthopedic conditions, so the heat of the pool helps with that. The occupational department has some adaptive equipment that we can also train patients to use to help them with their feeding, their dressing, their bathing. We were also able to get a laser cane, which helps patients with freezing to prevent them from falling.
Okay.
So physical therapy and occupational therapy, we use all these resources to try and let them have a better quality of life and manage their symptoms.
Right, absolutely. So therapy kind of can stop this, or it can make it better at the time, but is it really a cure for Parkinson's?
There isn't a cure for Parkinson's, but it can help manage the symptoms.
Okay.
There's a part of the brain that produces a chemical. It's called dopamine. And in Parkinson's disease, that is lost or is diminished.
Right.
But exercise has been shown to improve the dopamine.
Right.
And so exercise is very good. It won't cure it, it won't stop it, but it'll help manage it and help slow down the process.
Right. Okay. All right. So we've learned now what therapy can do for folks. So we're going to change you out, and we're going to go over to Bridget. She is a speech therapist. Y'all are physical therapists.
Yes, ma'am.
She is a speech therapist, and we're going to see how a speech therapist can actually help Parkinson's disease. We'll be right back.
Allie collided with another student and hit head-on very hard, and she had a goose egg. They advised us to go ahead and bring her in. We saw a PA at first. She just took the time to get to know Allie before she started. We were just very, very impressed. Everybody was very nice, very sweet, very happy, smiling, from the nurse, from the CNA, to the PA, to the doctor. We would definitely recommend NASH to other parents, other people in our community.
Welcome back, and now we have Bridget Duarte. Good morning.
Good morning.
So glad to have you on, and you're a speech therapist.
Yes, ma'am.
How does what you do play a role with Parkinson's patients?
All right. As Tina mentioned, one of the signs of Parkinson's is a low voice or a soft voice. So that's one of the areas where speech therapy comes in.
Okay.
We have an exercise program. Yeti mentioned that we received a grant from the Parkinson's Foundation for specialized certification training. For speech therapy, it's the Lee Silverman voice treatment, and it's to deal with using a loud voice under several conditions to get the respiratory system and to get the vocal system functioning as well as it can.
What can NASH do, Bridget?
So that's one of the things that we can do with exercise. That's one program. We have another program that focuses on more of intentional speech. So versus speaking loudly, this is speaking with purpose. We can also help with cognition. So frequently folks will have some trouble with memory or just overall thinking and paying attention related to Parkinson's effects. And so speech therapy also helps with that. And we also deal with swallowing difficulties. So swallowing is a motor movement-based process.
Right.
And we know that Parkinson's affects movement. So with speech therapy, we do some instrumental testing to see how patient's swallow function is, and then we can do exercise to help strengthen that.
Right.
Yes.
Wonderful. Well, what are some of the resources? I know folks, need resources so that they can reach out for help. Children, their parents have Parkinson's and they don't sometimes know where to turn. So what are some of the resources that are available?
So one of the best resources is the Parkinson's Foundation, and they can be reached either by phone or via website. I don't know if you all are going to post these or
Yes.
not. Okay, all right.
Yes.
So they'll be posting that. For North Carolina resources, there's ParkNC, which also is a website, and that speaks more specifically to North Carolina resources.
Okay.
And then, of course, you can call us. So at Rehab Services, Nash Day Hospital, the phone number's there, and you can ask to speak with any of the therapists who are trained in Parkinson's therapy, and we'll be happy to answer your questions.
I didn't ask the other two girls. I do want to ask you, what age group do we see? Is there a specific age group that we see Parkinson's?
So I think we had mentioned earlier that 96% or so of folks
Right.
with the diagnosis are in the 70, 80-ish.
So it is kind of uncommon to find someone in their 40s, 50s that has
Yes.
Parkinson's.
Yes, but there are folks out there who do present with symptoms, but
Right.
it's not as common, you're correct.
Right,
Yes.
okay. Well, thank you for being on this morning. I really appreciate this conversation because, as I said, I think Parkinson's has become more prevalent this day and time. So we'll give you the number 1-800-4PD-INFO, which stands for Parkinson's disease. 1-800-473-4636. 1-800-473-4636. Or you can call NASH, the Rehabilitation Services, at 962-8845. 962-8845. They will provide you with resources. There are handouts, there are brochures that you all can provide folks with.
We do have some, yes ma'am.
Yes, so don't hesitate to call, and don't hesitate to call if you feel like, I think my parent may be getting Parkinson's, but I'm not sure. You do want to get this checked out. You definitely do. So anyway, don't hesitate to call. Thank you, ladies, for coming this morning.
Thank you so
Bridget,
much. Thank you.
Tina, all of you for coming this morning. It's been very informative. We'll be right back with more of the Don Bullock Chevrolet Morning Show right after this.